And the aim of these is to help you as managers of volunteers to collect more data, improve your service and improve its impact. I know that a lot of the colleagues we've got on the call today are from hospital trusts and a variety of different settings, acute, mental health, community settings. We've also got some colleagues joining us from other settings out in the community or out in systems. And although a lot of the stuff we'll talk about today is framed as, I do think it's applicable to all volunteering in health. So I hope you get a lot out of it. So we've got a series of 3 webinars. The first one today tries to just look at the big picture. Why evaluate? Why do this? Because it is a lot of work, it's a lot of effort, but what are the rewards and how do we go about it? So we're going to hear from our friends at Nuffield Trust. Nuffield have been working with us the last year and a half on the Volunteering Innovators Programme, and they've produced a guide that you'll be able to access on our website today and download and use. And they're going to walk you through some of the highlights of that. The second session a week from today, we're going to have some other colleagues from PPL, who are another consultancy who specialise in evaluation in the health settings. They've also done some work on the Volunteering Innovators Programme, but in particular looking at learning from how kind of data collection and evaluation worked or didn't work on the VIP programme. And it's sharing some of the lessons from that in terms of what worked well, but actually what was really hard, what didn't work so well. And they've got some really interesting insights and barriers, which I think will be really helpful to many of you in terms of getting your teeth stuck into evaluation. And then in the final session, we're going to introduce a new service that will be launching at the end of May, around about this date, the 27th, which is called the Health Force Insight and Impact Service. So what we're going to learn if you could go back to that, V, there's a little video showing at the moment with a bit of a preview of what the service is looking like. We're just building it at the moment. But what you're going to hear about in the series of these 3 webinars is hopefully a lot of really great advice and good tips to how to go about evaluation. But with the I&I service, it's also going to be an option that gives you a slightly more hands-on support from our team. But there's going to be different ways of looking at this. There's going to be the guidance and advice we hear from Nuffield today. But there's also going to be this service, which we're going to be launching for not just hospital trusts, but for anyone who manages volunteers in health settings. I hope you can join us for all 3 sessions. And the final thing, just to say thank you to NHS England, who funded the Volunteering Innovators Programme and therefore get the credit for producing the report you'll see today and the work that PPL have done. So why evaluate? This is something I feel very passionate about. So if you don't know who I am, I forgot to introduce myself. I'm a director at Health Force. I've been with Health Force since the start. And evaluation, or insight and impact as we call it, under kind of my remit. And it's something I feel very passionate about. I mean, my background was data and digital, and I feel very strongly that one of the things we've got to do to really maximise the potential of volunteering, which I do feel very passionate about. I'm a volunteer myself, and I feel that it does fantastic things for health and care. But to really maximise its potential, I do believe that we've got to do more evaluation. And what we talk about in this diagram is the link between the fact that doing more evaluation, collecting more data, getting more evidence is going to be one of the key things I think that's going to unlock the potential for volunteering. And everyone on this call is going to play a key role in that. So, it's my kind of mission in life to try and help all of you do evaluation, get more data, get more evidence, and try and fulfill the full potential of your service. In terms of evaluation, one of the things we've got to crack is it's not just something that's done at the end of a particular special project. It's not just because you got chosen for the Volunteering Innovators Programme, you got funding, you do evaluation. And what we're trying to do, particularly the I&I service we'll talk about in the 3rd week, is try to make it more accessible, make it easier to access and easier to use so that we can get more people doing evaluation. We need to be evaluating not just special projects, but some of your best, most established roles, some of the new emerging roles, looking at evaluating your service as a whole, not just particular roles, but your overall volunteering service. How can we capture data that helps you improve the quality of that service? By doing more evaluation, we get more data. I'm a nerd. I love data. We don't have enough data in the volunteering space. And this isn't just the impact data, which we all think about, that kind of qual data. It's activity data. Pat from Samwell is going to talk today about what they've done at Samwell. Better Impact played a key role there, a volunteer management system, so getting that activity data, but also the data that tells us, does this work, the impact data, but also the insight data, the kind of PDSA stuff that tells you actually who can we talk to and what data can we get and what questions can we ask that actually makes our service better, makes our role better. So it's looking at data more broadly and about all the benefits that can bring. With that data, we have evidence, and with evidence, that can be the quant stuff, the qual stuff, what I call hearts and minds. Not only the evidence of impact, but like I say, the data that tells us how can we improve this service? How can we not only improve the volunteering service, but how can we improve the discharge service or the hospital to home service that actually those volunteers are involved with? And so with all that, hopefully we can achieve more impact, a greater impact on volunteering. So quality improvement, as I touched on there. Sorry, V, not done yet. Raising the profile of volunteering, making it more mainstream, which, to be honest, COVID has done a fantastic job for. But as we know in hospitals, it's really been hard to retain the levels of volunteering we had before. We need to bring that back. Evidence can underpin business cases. With a business case, we can look for increased investment and ultimately, create more volunteering opportunities. So volunteering can play a much major part of the recovery of the NHS. Thanks, V. You can move on now. So that's my bit over. I'm going to now hand over to our friends and colleagues at Nuffield Trust. As I mentioned, this guide they're going to give you a quick whistle-stop tour of is available today on our website. You can see the link there under the kind of publication section. So I do encourage you to download it. There's a lot of great detail in there that Steph and the team won't be able to cover today. So please download it. And I'll hand over to Steph.
It's going to be me actually, but thanks, Paddy. So thank you first of all to Helpforce for having us on this webinar, and to Paddy for this introduction. And it's really nice to see so many people here from a variety of settings. So my name is Camille Ung, and I'm a researcher at the Nuffield Trust, and I'm here with my colleague Stephanie Kampunen, who's a senior fellow at the Nuffield Trust, she's waving, and the lead author of this guide. And I also wanted to acknowledge a much larger team that was involved in the process of making this guide. So in case you hadn't heard of the Nuffield Trust before, we're a health and social care think tank, and we undertake evidence-based research in order to inform policy and debate. And we've had quite a lot of experience in evaluations of the effectiveness of health services. We run an evaluation conference every January, and we also have some experience looking at volunteering initiatives. So Stephanie, with input from the rest of our evaluation team, put together this guide to support yourselves, so volunteer service managers, to undertake robust evaluations of your services. And why? Well, because we think that high quality evaluations can support services being funded and embedded into practice, to identify what's working, what can be improved, and also to provide evidence to other sites so they can adopt your programme and adapt it to their own setting. So today we're going to talk you through how to navigate the guide and some key insights for a robust evaluation. And just before we move on to this background slide, I just want to stress that we're not going to be able to present the entire guide because it's about 50 slides long. There's a lot of information in the guide which we won't be able to cover today, but we hope that you can take a look at it at your leisure. There's lots of examples which we hope you'll find compelling. So just by way of background, 2 years ago, Helpforce funded 12 sites to be Volunteer Innovator Programmes, or VIPs. And I think so Pat is here from Sandwell today to talk to you about her experience of the initiative that they embedded. And so we at Nuffield were tasked with reviewing the interventions in the 12 settings and identify whether any had the potential for a robust outcomes evaluation. So whether the intervention could demonstrate an observable impact on your chosen outcomes. So in this case, the interventions were seeking to have a positive impact on the experience of patients, to increase volunteer employability and health, to support staff within the hospital and also the wider system. And so we wanted to choose up to 3 sites that we could support then with a more in-depth evaluation. And we devised a set of criteria around what makes a good evaluation, and we called it, and let me see if I can say it, an evaluability assessment framework, which is a lot of jargon, but included questions like how clearly is the intervention described, what indicators have been chosen, can they be reliably measured, And so what we did was we assessed the documentation provided by the VIPs, and we undertook some interviews with the site managers to get more depth about what they wanted their service to achieve. So we chose 2 sites to evaluate in depth, and Sandwell was one of them. But unfortunately, the pandemic got in the way, and so instead our team has been working with Helpforce to develop this guide to support yourselves to think about evaluation when you're designing your programmes. And so it draws from examples that we found in the 12 sites, so we hope it will speak to you. Could you move on, V, please? Thank you. So just before I hand over to Steph, I wanted to highlight 4 issues in evaluation to consider. So firstly, what is the purpose of your evaluation? So what will the information you collect be used for? Who are you trying to reach, and what sort of evidence will they engage with? So for example, a hospital board that could be funding your intervention will expect some strong evidence that it's working. What resources are available to you? So how can you use them to your advantage? So you might have existing QI teams in your hospital. You might be able to access them, and if not, you might need to reassess the scale of your evaluation and really think about whether you have the right support from key people in your trust. So it's really important to have a working or steering group. And then finally, what does your intervention want to achieve? So what's the rationale for your service being implemented? Why do you think your service is likely to have a positive effect, and for whom? So I now hand over to Stephanie, who will talk you through how to use the guide.
Thanks, Kemi. So Kemi covered the introduction, the background, and some issues to consider before you begin. And I'll cover the 4 steps of evaluation, some questions to ask yourself, and how to use this guide. So this diagram references the 4 steps of evaluation, which we talk about all the way through the main section of the guide. The first step is describing how and why your service works. The second step references planning your evaluation with a working group. Step 3 involves collecting and analysing data. And step 4 is about reporting your findings. I'll go into a bit more detail into these steps on the next slide. Thanks, V. Okay, so this is a checklist. Each of these boxes represents an evaluation topic that we think is important for you to consider in your evaluation planning. So step 1, when you're starting your evaluation, we'd encourage you to think about the relevance and clarity and complexity of your service. So some of the questions you could ask yourself to help prepare are, what's the problem that my service is trying to solve? Is my service clearly described? And am I clear about what the goals are for my service? And once you've ticked those off, move on to step 2. And step 2 asks you to think about, or to build a stakeholder group, to build people who you could work with as a working group to help you plan, deliver, and report your evaluation. And the first question I think you probably need to ask is the representation within my working group sufficiently wide? Do I have people at senior levels, people working on the ground? Do I have patients who represent varied backgrounds? And then you could move on to think about your timeline. Is my evaluation timeline clear? What's the start point? What's the end point? And is it likely that my service will achieve its goals within that timeline so I can measure them? Are the measures that I've chosen realistic? Are they able to pick up the success that I want them to? And then think about your context, the context of your trust. Are there any enablers or barriers? Enablers could be things like a month that's focused on evaluation, or a month that's focused on volunteering, for example. Could they help you in your evaluation? And then lastly, think about ethics and governance. What approvals, if any, do you think you might need to do your evaluation? And involving someone from your R&D team within your trust, within your working group, could be a really great way of answering that question. In step 3, we ask you to think about how to collect and analyze data. And 2 big questions that we'd encourage you to think about are the start point of your evaluation and what data you can get about the baseline. So what does your local environment, the ward that you're working on, what does it look like before your service is in place? And then how can you measure your progress over time? And what will you compare that progress to? Will you, for example, compare some of the patients in your service before and after they've experienced your service? Or would you compare their experience with another ward that hasn't had your service? That point of comparison is a fundamental area of evaluation, and that makes a big difference between evaluation and monitoring. So just tracking things over time versus really making comparison and demonstrating your progress. In section 4, we cover reporting, and I think I'll pick up on what Patty said. There are 2 ways to report your findings. You can report them as they emerge. So new findings that you see can really help inform how you shape your intervention over time and how you shape your evaluation over time. But you can also choose to report at the very end. Once you've got all of the data and you've written things out, the only thing I'd stress between making your choice is make sure that you talk to people within your trust about when it's important to receive that information. Aligning your reporting timelines with when people need key information about your service is really, really important. Via, I'm ready for the next slide. Thank you. So the guide is very dense. I think it's somewhere almost 50 pages, and it's full of quite a lot of information, and we want to make it very easy for you to navigate. So I'm going to walk you through what a typical slide might look like. Okay, so at the very top, you've got your title. Underneath the title, you've got an example or a description of the evaluation topic that we think is important. Then we've got some examples of good practice of evaluation and practices that could be improved in evaluation. And those are drawn from the VIP program and from other evaluations that we've done in NHS organizations. We've then got a reminder. We've got a reminder of the checklist questions from I guess, slide 8. And then we've got the top tips that we came up with together with the VIP program to think about how to overcome some of the common challenges that they experienced. And we think that if you're able to confidently answer the questions from the checklist and you see your practices aligning with the examples of good practice, you are in great shape to deliver an evaluation. Okay, I think next slide, V. Thanks. So moving into the main section of the guide, the 4 steps. We've written this guide so that you can go through steps 1 through 4 sequentially and sort of build up your knowledge and experience of evaluation over time. But we recognize that that isn't always going to happen in a logical way. So we've introduced something called a navigation pane here. And that navigation pane has hyperlinks. So when you're in the guide, you can just jump in between topics, jump in and out, just so you can get a bit more information as you go along. I think in terms of logistics, that's probably enough. And I'm going to hand over to Camille now, who's going to go over step 1 of the evaluation guide.
Thanks, Steph. So V, if you could move on to the next slide. Oh, so this is just to show you the navigation pane. Great, yeah, if you can move on, thank you. So skipping to clarity and complexity. So the first step of an evaluation is describing how your intervention works. So this is your program theory or the rationale behind why you think your intervention will have a positive effect on those that you want to reach. And so our evaluation guide gives you some resources to help you present it in a coherent way, so both for yourself, but also so you can describe it to those that you want to influence. So this slide that you can see currently is one of 5 slides around this in the guide, so please do go back to it in your own time. And it shows you a logic model, which is one way to describe how your programme is intended to work. So it will help you figure out what you need to measure and where. So there's worked examples in the boxes throughout the section, but just to kind of describe you the main idea. So on the left, you've got your input, which is what you need for your intervention. Then you have your activities, which describe what the people in your intervention, so in your case, volunteers, will actually be doing. Your outputs will be what will result from the activities being undertaken. So it could be X number of patients being supported by a volunteer. So these can be quantified. So it goes back to the points around data that Paddy was making. And then finally, your outcomes. So these are the long-term changes that will happen as a result of your intervention. So come back to the examples in your own time. But the other slides in this section also help you to think through whether your logic is plausible. So whether your intervention can achieve your goals, given the resources that you have and the time that you have, and also sustainable. So whether it can be maintained on its own in the future, whether there will be other things that will need to be in place to help you sustain it. And you should, as much as possible, try to specify the link between your indicators of success and your long-term outcomes. So, for example, how will training X number of volunteers to support with mobility improve overall rates of patients falling and prevent long-term physical deterioration? So, yeah, we've included lots of good practice and things that can be improved too. I'll hand over back to Steph now.
Thanks. Okay, so Camille covered one of the evaluation topics in step 1. I've skipped step 2 and I've gone straight into step 3 because I just wanted to flag, in the interest of time, one really quick point. We saw in the VIP programs that they had huge success in involving data analysts and quality improvement teams and helping them think about how they'll collect data. And those teams were especially important because they helped identify what data was already existing, how frequently that could be collected, and where the gaps were, and where the gaps were where data needed to be collected. And I think I'd really like to stress the point here that data can mean numbers. It can also mean stories. both of them are equally compelling when it comes to describing your service. Cammy's now going to talk really quickly about step 4, and then we'll hand back over to Paddy and Pat, and thanks very much.
Yeah, thank you. So the final aspect that we wanted to touch on is how you reflect your findings. So choosing the right means of communication for who you want to influence is really important. So on the leftmost column, you've got the different types of output that you can use. So recommendations papers, case studies, evaluation reports, or academic publications. And so the kind of middle box for whom is really the key question that you want to ask yourselves. And so from our experience, we find that policymakers or hospital boards engage with recommendations, but your average patient isn't going to want to read a 200-page report on evaluation, but this can be very convincing for commissioners. So we try to include some examples of papers that we think are good kind of references that can help you inspire you in the write-up of your own findings. And so just before I hand back to Paddy, I just wanted to conclude that we think that evaluations are a really powerful tool to show you and others how your volunteering services are making an impact and communicate those benefits to your hospitals and to help scale them up to other areas. And I think they're very daunting, but they're definitely not impossible. And I think Pat will talk through that in a moment. So I'll hand over back to Paddy now. Thank you.
Great, thank you, Steph, and thank you, Camille. That's really great, really good. I'm going to hand over to Pat. So Pat is the volunteer manager at Samwell. Samwell was one of the trusts in the VIT programme that worked quite closely with Nuffield back in the first early stages. Over to you, Pat.
Thank you, Paddy. I'm volunteer service manager at Samwell and West Birmingham hospitals, and we were involved in the Volunteer Innovators Programme, which Help Force had supported us in, and it was brilliant. I wasn't the lead. Let me just explain that right at the beginning. At the time, it was Jonathan Madison, who's no longer working with the trust. So I'm picking up on this. And two of the questions that was put to us was, how was the project evaluable? Looking at what data did we use to collect that was able to evaluate the service that we were presenting. And the second question was, what was the importance of evaluation and how evaluation makes a difference to the service? Brilliant questions. So the first question, how was the project evaluable? We found it was important to identify what measures will best demonstrate the impact and benefits of the service that we were doing. It's activity and mobility support. That was our project, and that was the area that we felt we wanted to enhance and use volunteers in. We looked at a number of different things we could measure, but we're aware that we couldn't prove a definite link to the volunteer intervention. But part of the data we looked at did give a very strong correlation between the intervention provided by a volunteer and the patient not needing to be re-referred for therapy service. This then indicated to us that the work volunteers were doing to keep patients mobile made a difference. So we also looked at other areas as well, such as length of stay. Did they stay in hospital for a shorter time than average? But that was difficult to demonstrate what the impact was in that area. So we actually looked at 3 areas really that we can pull out. That's what I'm going to do, pull out 3 areas that we looked at. That was the impact with patients, the impact for staff, and the impact for volunteers. So for patients, the impact on their outcome was, did the intervention make a big difference to how well they were or otherwise when they left the hospital? And also, did they appreciate or enjoy the volunteer support they received? That was the first thing for patients. For staff, did the volunteer intervention help them in their daily work? And did they think it made a difference to their patients? Which is also important because we don't want to give them more work to do we? It's all about helping and assisting and enhancing. And volunteers, did they find the role valuable for them? And were they well supported? So these were the areas that we felt was important to look at, to get feedback from, to be able to evaluate the service. We asked 4 questions really as part of the project, and it was, does the volunteer mobility service help to reduce referrals to the physio team? And we found, based on trend analysis in discharge ward, patients were less likely to be re-referred for physiotherapy when volunteers supported with their mobility, because it kept them mobile. The second thing was, do patients have improved mood as a result of volunteer support? So it wasn't just about physical, it was about their whole, really. That's what we were looking at. We found 93% of patients agreed or strongly agreed that the volunteer had cheered them up or improved their mood. Are volunteers satisfied in their role as mobility volunteers? And we found 90% of volunteers were likely, extremely likely, to recommend volunteering at this hospital to their friends and family, which proves really, yes, you know, they were satisfied with the role and all that was involved in it. And our final in that section was, do mobility volunteers help with patients, help patients maintain their usual level of mobility? One potential impact we found area was reviewed with the proportion of parents, get my words in my brain, the proportion of patients discharged to their usual place of residence, because that's what mobility was. That was what we were trying to achieve. We want them to go back to their homes where they lived and they were able to live independently. We didn't want them to go into a care home. You know, we wanted them to maintain that mobility. And I've got really, I thought I had to stress this, that 85% in December 2018 went back to their usual place of residence. But by April 2019, and we're talking 4 months, with increased activity of volunteers, 95% of our patients went back to their places of residence. You know, 10% difference in 4 months. So to me, it was worth, you know, the evaluation. It was worth it all to do this. So our second question, and this is not going to be very long, the importance of evaluation and how evaluation makes a difference to the service. We found that evaluation is an essential part of quality improvement. And when done well, it can help solve problems, inform decision making and build knowledge. And that was the Health Foundation words, but it's exactly what I felt. In some trusts where volunteering is not particularly highly valued or invested in, we found evaluation can help get the resources needed, as you can demonstrate the benefits very clearly. Volunteers logged hours and interaction details on our volunteer management system, which was Better Impact. That was also introduced through Helpforce, and they helped us to get on board with that. And to be honest, in addition, since lockdown, we have used it in ways that we didn't think we could. And it's been a real help these last 12 months. And we're doing different things with it that we didn't need to do before this, but now we will maintain it. So we were able to look at the activity that each individual was involved with. They were able to answer specific questions that related to their role, and we were able then to draw the results from that. So really, for me, finishing off, evaluation gives insight into the patient journey, as well as staff and volunteers. It ensures we're still adhering to the service principles. It's flexible in our approach with our volunteers, their times, their rotas, what sites they volunteer on. And lastly, evaluation helps us to apply, you know, knowing what these results are in other areas. It can be improved upon. It's scalable. We can make changes. We can put it in other areas and maybe focus on different impacts, but we can do that. So that's really our personal experience about activity and mobility support and our volunteers. The report is on the Helpforce site in the resource section, and I'm sure V can give you that information, and I hope it's helpful. Thank you.
Thank you so much, Pat. That was fantastic. And you know, I've not spoken to you for a while, so to hear how well it's all been established is brilliant. I mean, a few points on that. I mean, Pat's almost as passionate as me about all the numbers and the data, and that, I mean, that just fills me with joy. But you know, being able to quote those numbers and talk about the impact, you see the prize, because actually, as we'll talk about next week, you know, there are a number of barriers to evaluation data collection. It's no picnic. It takes some hard work and some dedication, particularly the data collection bit. But when you can see the prize and you can go and talk to your leadership about those numbers, that improvement in 4 months, I mean, that's fantastic. I think what's also interesting is that Samuel collected so much data, not just some of the data that we agreed to collect that was very specific to the intervention, but a lot of activity data from Better Impact, which we were constantly tidal waves of it importing into our systems and analysing it. But we got great. Not only did we get great results at the time, but we started to find some fantastic patterns after the project had finished, going back and looking at some of the data from the wards where volunteers were involved and comparing that to things like length of stay and reduced readmissions, that sort of thing. Didn't always find a pattern, but in some cases we did. And I think it's like you could never have done that unless we had that data. And as I say, the final thing is how well it's been established and carried on. So I think it's that concept of it's not just a one-off. Actually, there's great advantages to keeping that going. Pat, thank you so much. Thank you, Nuffield, as well, for some fantastic points there. So over to our audience. I don't know if we've had any questions. We've had one question or a few questions come in, but Sal, do you want to guide us through that? And also, if we need to, we could take questions from people verbally as well.
Yeah, sure. Thanks, Paddy. I've got my camera working now. Apologies about earlier. We've got a question from Umit, who's recently joined the network. Umit has a question about the challenges that colleagues may have faced with implementing an evaluation framework.
Is that directed at Pat or one of the rest of us, or is it more open to the entire audience?
I think the entire audience. So I'm coming from a local authority, so I don't actually necessarily have an NHS background. I think Sally and I have had wonderful chats about this kind of stuff. So working on a public health programme to help deal with health inequalities, and the volunteers are very much at the heart of this. We call them community champions to help with these kind of health inequalities. And one of the things that I think is very important is to ensure that the volunteers are having a great experience because they are giving up their time, but also more importantly, what impact are their efforts making, which aren't necessarily being picked up in a kind of public, in NHS data kind of data set. So therefore, clearly they're having some impact. So by helping to signpost people to the right services without having to go through many hoops and jumping through many hoops, as we know it can happen, how does that impact on the local community, for instance? So that's something I'm quite keen on doing, because I think we've got a very specific remit around health inequality. So if anyone can enlighten me around any of the challenges, especially if you're working in a multi-agency frame kind of environment, I'm all ears. So
shall I suggest that if anyone wants to stick their hands up, Pat, would you like to have a go at answering that? And then while we're just waiting for some hands to go up, but I'll be very happy to open it out to the wider audience. It's a really good question.
Okay, so you want the challenges as in what volunteers? Because when you said challenges, my first thought was the right volunteers to get involved in that role, recruiting the right volunteers to get in that role. I was thinking the challenge there is, have they got a passion to be that, up close with patients and wanting to encourage them to move, to get out of their pajamas and get dressed, to wanting them to, do a bit of exercise, because you get a lot of volunteers apply to, especially we're in an acute trust, and they volunteer and they don't really know what they want to do. And they're trusting you to put them in the right place because they're not sure. They've never experienced a hospital before. And I just think, for me, that's the biggest thing. It's getting the right volunteers, because they will give you longevity. They will be the ones that will stick it out. They will be the ones that will, adhere to, the things that you want them to do, to signing in when they come, to, and signing out, to put all the details in on Better Impact. They will answer the questions. I just feel that sometimes we have a tendency to think we need volunteers, so we'll have anybody, and that doesn't work. I don't believe it works. It hasn't worked for us.
I'm hearing that. I'm having that current challenge now, in the sense that, so I'm a volunteer myself, and I'm now kind of over to the dark side, as I've often been told, and I come from a very, very different background from public health. I'm actually a corporate finance guy, so I'm an old school city boy. Give me a spreadsheet, I'm very happy. So I'm a bit of a data geek as well, but I'm very passionate about what COVID has shown, especially where we live in Brent. The impact on communities, devastating impact, but also it's just blew the lid open on health inequalities and the real challenges there. And you're right around finding the right volunteers. So at the moment, I'm having an ideological debate around that with my colleagues around what do we see volunteers as a resource? Well, I think that's wrong, because then you're just fundamentally, people are giving up their time for a just cause. And if they're not aligned to that just cause and their cultures, the cultural ideology, their beliefs and that, they're not going to have a great experience, because as far as they're concerned, they're not going to get it, and they're just going to feel like, oh, they're just throwing me to do this, throwing me to do that. This is not what I signed up for. This is not a clear remit. So that's certainly one side of the kind of the challenges I'm talking about. But also the other side of the challenges is also working in a multi-agency environment, where we are. So we're working with three other health partners within the NHS. We're working, I think, with CNWL and I think a couple other trusts as well. But there's sometimes a bit of a clash between, we need to look at the data around the impact on vaccine take up. But the flip side of that is, how effective is our messaging, which is impacting on vaccine take up. So that's where the role the volunteers have. So it's trying to understand kind of those challenges within the environment where you may have potential clashes between what's important data, which effectively helps us evaluate whether this program's been effective. And it's trying to break those barriers down to say, well, look, we're going in with one view, but what is that one view? So I think those are the kind of challenges I'm thinking about, but not just necessarily just collecting data. But the other side of it is also asking volunteers to, by the way, in effect, fill in a timesheet, right? At a very basic level. What are those challenges to kind of get them? Because all this information is very important. It's enriching. It helps with future funding, for instance, if you're doing it really well and you've got data. Cabinet Office wants to see that stuff. So I think those are the other things that I'm kind of interested in trying to understand. Anyone facing those challenges, or what has been difficult to do and then has been overcome, because I think there's a win here clearly, because it's worked for Sandwell. So it'd be interesting to hear those kind of views if anyone's got any, or maybe share them in the chat, maybe not have a too big a discussion about it.
Umi, thank you so much. It's really great to have the multi-agency perspective in the discussion. So thank you for that. I'm going to move on to some other questions, if that's okay. Mandy from Sussex has a question for Pat. Mandy's interest. Yes, sorry, you're a popular lady.
Got the star, Pat.
Mandy's interested in seeing whether your trust is investing funds in this area. Mandy, does that mean evaluation?
Well, I thought, as it's been such a success, I was just wondering if they were, going to be bringing this role in permanently, Pat, and whether they were giving you any more investment to do it, because obviously, it's taken a lot of your work. And have you had any extra, funding assistance to roll this programme out permanently?
Yeah, to be honest, it's embedded now in our trust. That particular, that project, the mobility, it's seen as it has made such a difference. I think now it is part of, some of you might remember Sarah Olay, she sort of headed up the clinical side of it. Now she, she's contacted me since, now they've started a discharge to assessment in homes. And she's saying, Pat, have we got volunteers that can just come in and help? And because they have experienced what volunteers can do. Volunteers are quite highly rated in our trust, to be honest, in all areas. So for me, this is something that we just carried on. We obviously elapsed because of COVID, but to be honest, it's the first group of volunteers that we have talked about returning, because now certain sites of ours is clear, COVID clear. So now we can reintroduce our volunteers, and they're emailing us, ringing us, when can we come back? We've had our vaccination, can we come back? So to me, that speaks volumes, it's supported.
Pat, it sounds like you've swallowed up this service within your resource team, so you've managed to just utilise this project within your team without. Yes. And hats off to you for doing that, because that's never easy, is it? When they that's never easy. So hats off to you for doing that.
Yeah, they're looked after by, obviously they're looked after by the wards that they volunteering, but we look after the volunteer as a whole in terms of keeping them up to date with training, etc., etc. But the wards will take care of their volunteers. They have a go-to person, you know, that will look after them, their questions, etc., etc. And it's usually people that are very interested in mobility. They could be training to be physios, they, you know, they're training to go into medicine, or clinicians. It's, you know, so those are the volunteers we've got, so they're dedicated, you know, and they want to be involved. So yeah, and our volunteer service is supported by grants and things like that. There's only the volunteer service managers that are actually part of the establishment. Our other staff here, they are basically supported by grants, and we have to do that, you know, every year, make sure that they're covered.
Great, thank you, Pat. Thanks, Mandy, for your question. I'm going to go to Jill's question. Jill from East Sussex. Pat, Jill is interested to know if your work has increased capacity and resources to continue with evaluation. So it's on the same theme as the previous question.
Yeah, to be honest, we've got all the data there. I can't say that we're pulling it, you know, every year or every 6 months. I can't say that we're pulling that information. The data is there because obviously the volunteers are logging in, logging out and doing their thing, apart from last year, you know, and they're putting their comments and they're answering the questions. Those things are still carrying on. So so we can pull that information, and I would imagine that probably when everything's back to normal, we'll look at that again and have a look at the results again and see where how we've done, you know, since December or April 2019, whenever it was. So it'd be nice to have a look and see where we are with it. But we're introducing new volunteers all the time as well, because obviously some will move on to do their own thing. So yeah, it's I think it's an ongoing thing. It's an ongoing thing.
Thank you. Thanks, Pat, and thanks, Jill. Paddy, we got time for one more question. Claire's asked, how many volunteers do you have in the mobility volunteering role? It's a nice, simple one.
I knew you were going to ask that, and you know, I haven't got the number for it. I know Jonathan had got it in his report, but I can find out, and I can let you know. Let's have a look. Project started with 40 volunteers providing support across 2 wards, and scaled in a period of 10 months to 58 volunteers providing support across 3 wards. But it wouldn't be that now, clearly, because of everything that's happened. But yeah, it'd be I can have a look at that, and you know, I can get back to you and tell you what it was before COVID.
Thank you, Pat. We've got V, is that you with your hand up?
Yes, sorry, I just can't have. I really want to ask this question, if that's okay. If they want, I have this question for Stephanie and Camille, really. So based on what you've been sharing about how to do evaluation, it seems like you need a lot of resources to do it, like a lot of people to do it. Would you say so? I mean, I know a lot of trusts, they like 1 month for whole team. If they really want to do evaluation, sorry, how do they do that if they only have 1 person in the office?
Shall I start, and then Steph, if you want to continue? So I think it's a really good point, and I think all of the resources that we have, you know, they're quite detailed, and it's quite possible that you can't engage with all of it or do it all on your own, because, you know, a lot of the time you're a single person that's trying to do that work. I think that there are also opportunities to link up with other, you know, so your QI teams in your trust. So I think, was it Sandwell, that there was one of the trusts, or a few of the trusts in the VIP programme that were linking in quite a lot with their QI teams or other monitoring teams within the organisation to kind of support them with their data collection and analysis. So I think there are ways to kind of support you, even if your direct volunteering service doesn't have maybe as big a team as you'd like.
Just to add to that, I think there's a lot that can be done. The initial thinking really is something that you could do independently. So what, you know, describing your service, you probably have the basics already done and written down somewhere. So you're probably further along in the process than you think. Everything's written out. You have a good description of your program. You probably have a good sense of what your goals are and how you could measure them. And then it's about possibly reaching out to those people who have the data analytics skills and saying, this is what I want to achieve. Please, can you help me think of some measures that I could record over time that would help me achieve that? So I think you're probably further along than you think for most of you.
Perfect. Thank you so much.
And thanks, Vee, for your question. Thank you all for your questions. I think we're just about out of time now, so I'll hand back to Paddy to close the session.
Yes, thank you, Sal, and thanks to our guests. Fantastic. I mean, some of the comments on the side there show how useful this has been. I'm really pleased to hear that. And hopefully what you've heard today makes a really strong case for why evaluating. I mean, if Pat hasn't convinced you, I don't know who else can. But what we'll do in the next couple of webinars is really try to say, right, that's the why. Let's dig into the how. So we're going to hear a bit more. You've got the evaluation guide from Nuffield now. We'll hear a bit more next week about some of the barriers and how to overcome them, what we've learned the last couple of years from BIP. And in the final session, we'll introduce the new helpful service that gives you a bit more kind of support from our side with trying to move this agenda forward. So I really hope you can join us all. If you haven't got the invite in your calendar for the next couple of weeks, because we've had to do it through Eventbrite, let us know. We'll get that sorted. We'll get you the invite over. So I really hope you can attend. And if you've got any questions in the meantime, we'll send out the slides and everything, but do give us a shout. Thank you, everyone.
Could I just also add that we will send out a short survey as well. So be very grateful. You can let us know what you think about today's session. Thank you so much, everyone, and have a lovely afternoon. See you then. Bye.
Bye.